Think from the patient perspective, where will they go when they have problem? Think over it. A patient, when he gets a problem, he will first see where he should go. First thing is which doctor is comfortable with me. Correct? Normally, a family doctor or already a treating doctor, they will first contact them. If there is a hospital where that owner, who is a surgeon or a physician, has a pool of patients, and one of them is calling, and that patient knows that this doctor previously has referred my family member or my known person or other people because of lack of ICU whenever he receives a critical case. So don't you think this patient will think that why should I waste my time going to that place? Because this current critical state of my problem is not related to this hospital, even though the specialty is the same. So he will go to that hospital which is communicating to him saying that I have emergency, I have ICU services treated in this hospital, because the doctor may be confident enough to treat, but patient thinks that because my condition is little unstable, I don't want to take risk, let me go to the other hospital. Now you see how the footfalls come because of having an ICU. Having a good ICU and emergency gives confidence in the customer base, which means patients. As they keep seeing that this particular hospital has got good ICU and they are treating all the complicated patients, and these complicated patients are actually getting successfully treated and coming out, that builds trust in patients. So, in case of dependability, they come to that place. Similarly, when you say a complicated surgery, this is not an emergency, but just a elective case, but a complicated surgery. So you need to treat a patient with complicated surgery. Now, when you say this is a complication, maybe during surgery or after surgery, you might require some ICU care. Don't you think patient will think, okay, am I risking my life? And if you don't have the background record of managing such patients already and having a good ICU and managing complicated patients, their patient will take a call. No, I will go to the city. Many times when I speak to hospitals, they say, sir, whatever I may try to convince them, saying that you are not very sick actually, I can manage you, I can treat you. Still they say, no, I'll go to that city hospital. Especially because this is an elective case where there is no emergency. In emergency, they come to this hospital. After 2 hours of stabilization, they go to city hospital. In elective case, you counsel them for 1 hour, then they listen everything, they pay you the fees, and then for surgery, they'll go to the city hospital. Is it not the problem of 90% of the hospitals in taluk level and district level who do not have ICU? Why? Because it's not about ICU or your department, whether you are capable or not. It is basically about trust in the minds of people. The city hospital is able to provide the trust to them because they have complete services available. Whereas in this particular hospital, you don't have an ICU. So you are not actually doing complete service in your department. Naturally, people will not trust you. Then how can you get more footfalls? So when you don't get footfalls, how can you get revenue? So this is how ICU is linked actually directly to revenue generation in the hospital.